Good evening, everyone. A warm welcome to today's session. It's on bleeding in the first trimester. Now, bleeding in first trimester means it is initial 3 months, that is up to 12 weeks of pregnancy. It is quite common. It is almost in 20% of the pregnancies, it can be there, 10 to 20%. That means out of every 10 pregnant women, one or two will can present with the bleeding in the initial 3 months. Now, in old days, the ladies might tell even I had bleeding, but everything went well, so there's nothing to worry. No, it is a myth. So, whenever there should not be bleeding anytime in pregnancy. So, if you see a bleeding in pregnancy, yeah, it can be normal, it can get well, but sometimes it can have adverse effect or some other diagnosis which needs attention, treatment, and proper evaluation. So actually, it is very depressing for the doctor also to tell the patient that the result is not good or she's miscarrying after a bleeding in pregnancy. But it's very important for everyone to be aware of this, to know that they should go to doctor, get evaluated, and they should know where do they stand whenever they have a bleeding in pregnancy. So I'll try my best to put across what are the possibilities when any pregnant woman has bleeding in her initial months of pregnancy, how the doctor will be evaluating, what they should take care during that time, and in case by chance, unfortunately, if ends up in miscarriage, then what precautions they should take before their next pregnancy or during their next pregnancy. And I hope it will be of help to all of you. So, whenever a lady comes with bleeding in pregnancy, 50% of the time it can be a good thing, like it can be a normal thing and which gets well and baby grows well. But 50% of the time it can end up in adverse thing. So, first let's talk about something good. So, there's something called as implantation bleeding. Basically, a woman has a normal cycle and she gets pregnant immediately in that month, and even in her next cycle she will have spotting whenever she's expected to have her periods or minor bleeding. So they get confused whether it is periods or not. So when they come back to us for any other reason, like maybe pain or not stoppage of bleeding, then we tell them it is she's pregnant, and they get surprised that how is it possible, I had a periods or I had bleeding during my expected date in this month as well. So that is called as implantation bleeding. Why it happens is because when the formed embryo tries to get and attach to the uterine wall, there can be certain amount of bleeding. Generally, it stops with its own in a day or two, or sometimes it might require some medications to stop that bleeding. Generally, this is not harmful either to the baby or to the mother because the pregnancy grows well. It is just a physiological phenomenon, and we call it as implantation bleeding. Now, second thing which is of not scary or things go well is called as threatened miscarriage or threatened abortion, wherein the patient presents with bleeding vagina. When we evaluate, when we do a sonography, baby is growing very well, baby has nice heartbeats, and then we give certain medications and injections, pregnancy grows well for next 9 months. So that is called as threatened abortion. That is just a threat in that point. So, and in such patients, when we do a sonography, we might see something called as RC clot. That is nothing but like the way she bleeds outside, there can be bleeding internally also, and there will be a small blood clot. It takes 5 to 6 days, sometimes 2 to 3 weeks to get absorbed and resolved completely. But as far as that clot is there in the uterus, there is a threat that whenever body wants to expel that clot or wants to get out of it, there can be expulsion of the baby also. So in such patients, we do advise rest, certain hormonal tablets, certain injections, follow-up scan. So there are so many patients who present like this and they get cured with medications and things go well in future. Okay. Now, the other 50% where the pregnancy in bleeding is not normal, it is abnormal. First and foremost, like there are certain pregnant patients who miss their periods. We do their pregnancy test, comes out to be positive, and generally we advise sonography between 6 to 7 weeks to see the heartbeat and locate the pregnancy. Either the patient misses that scan or they wait, like there is a myth that we should wait for 3 months to undergo any sonography, or sonography is harmful to the baby. So for whatever reason they miss the scan, or even before the 7 weeks, she can present with severe pain in abdomen, especially either side of the tummy, with giddiness, with history of fall, with getting syncope. So these are the signs of a pregnancy in the tube, or in medical language we call it as ectopic pregnancy, or a pregnancy in the garbhanalika or the fallopian tubes. This is very dangerous. A pregnancy in the garbhanali tube cannot grow for 9 months, so it will end up with rupture or tubal abortion some or the other day. Neither, and very rarely it can get resolved by itself. Generally, it needs certain medications, or when a patient presents with rupture, she will have a torrential bleeding inside, which will be an emergency. She might require blood transfusion, and in that case, the surgical intervention is must. So everybody should be aware that till the first scan is done, till we see the baby inside the uterus, till we see the heartbeats, be careful. If you have a bleeding and pain, please contact the doctor. Yes, certain amount of bleeding and pain can be normal. Pregnancy can go in a very smooth way, but still these are the rare possibility where even if it is 2 to 4% for that particular group of patients, it can be risky to the health. And second rarest rare cause, but it can happen, is called as molar pregnancy, or in local language we call as drakshagarbha. In this case, what happens? Patient will have miss her period. There will be pregnancy test positive. There will be all signs and symptoms of pregnancy like vomiting, nausea, tiredness, giddiness, but it is not a healthy pregnancy. When we do a scan or sonography, we get to know that pregnancy is in the uterus, but it is not normal. It looks like small water-filled cavities within the uterus. It like a grape, small grape, so it looks like that. And if we let it go ahead, it again the patient can have very heavy bleeding vaginally, or these small vesicles can go through blood vessels, go to lungs, brain, and it can cause certain more adverse effect. So again, I'm telling you, first sonography at 6 to 7 weeks is very important to know that how the pregnancy has formed, where it has formed, how is it growing, whether it is single pregnancy, twin pregnancy. So that is very much important. So this is called as molar pregnancy. And one more point here, many a times the couple come to us with an unwanted pregnancy. They would like to terminate that pregnancy, or they want to abort the pregnancy voluntarily. And we suggest them to do a sonography. Then they were like, अरे हमें तो चाहिए ही नहीं, तो sonography क्यों बोल रहे हो? आप टैबलेट दे दो और हम लोग उसको terminate कर देंगे. But that is wrong, because any pregnancy, if it is ectopic or if it is molar pregnancy, cannot be terminated medically with only pills. They need surgical intervention or some other medications to cure it. So unless we know in sonography how the pregnancy is, how can you take the pill? So whenever anybody wants to take voluntarily any pill, sonography is must. You must do the sonography. Do not take medicines over the counter from anywhere else. Okay, done. Now, there are certain cases where pregnancy is in the uterus itself, things are well, but still it can lead to miscarriage whenever there is a bleeding in pregnancy. So, what are those? There's something called as blighted ovum or empty sac, wherein when the female egg and male egg joins, due to certain genetic defect, the fetal pole or the baby do not form. Only the sac forms, or only the bag where the baby is supposed to grow, that will be formed. So these patients will also present with pregnancy test positive, either in the urine or blood, and in the scan we can see the sac also. But when we repeat the scan after certain days, we will not be able to see something called as fetal pole, that is the tiniest thing which is going to become a nice 9 months healthy baby. So if that fetal pole is only not there, there's no point continuing the pregnancy. These patients might present with bleeding or may not present with bleeding, but we'll have to terminate that pregnancy depending upon their condition, either medically or surgically. So after the empty sac, second thing is something called as incomplete abortion, wherein patient will have bleeding, might have certain clots, and when we do a scan, we get to know that half the things are out and there are certain things still remaining inside. In that case, we will help you out with certain medications too, or maybe requirement of dilatation and evacuation to empty the uterine cavity. Now, sometimes patient has bleeding in pregnancy with passage of clots, with lot of cramps, and when they come back, we get to know that they have had a miscarriage and which is complete. There's nothing inside the uterus. So these are the possibilities. And there's something called as inevitable abortion, wherein the patient presents with bleeding. We do a scan, and we see the baby is all well, but uterus mouth or cervix would have opened up completely and which would not stop or which would not close with any tablets or injections. In that case, we still help the women to get through the process as soon as possible. All said and done, now one more, the worst part is missed abortion or missed miscarriage. It's really disheartening for the doctor also to tell the patient what is the diagnosis. So in this case, patient's pregnancy goes well. By 7 weeks scan also might show a good heartbeat of the baby. But over a time, patient might present with brown discharge or pain or bleeding, or in the repeated scan, we see that baby's heartbeat is no more there and baby's heartbeat has stopped, and that is called as missed miscarriage or missed abortion. Now, when the pregnancy is beyond fourth month or something, so in the clinic itself, in a small machine called as Doppler, we can see the heartbeat. But before that, before 12 weeks, there is no way to know the heartbeat of the baby or status of the baby without a sonography. So sonography is must in such cases. So this is called as missed abortion. Now, all said and done, why does this happen? That is the first and foremost question. Why does bleeding happen in pregnancy? What can we do to prevent it? So first thing, what happens, nature's beauty is that whenever a male sperm and a female egg join, if there is some problem in genetic problem in that particular egg or that particular sperm, the formed baby will also be not healthy. It will not have good genetic material. It wouldn't have the capacity to grow for a 9 months healthy baby and continue its adult life. So nature takes a call to terminate it as soon as possible so that it is not fittest, it cannot survive. So in that point of time, also the patient can have bleeding and abortion. So do not get disheartened. 20% of the miscarriages, the reason will be genetic problem in that particular baby. And if you do not have bleeding and miscarriage in early time, like before 3 months, it might show up in your third month scan, or it can show up in your fifth month scan, or nowadays we do double markers and quadruple markers that can show abnormality. So we have this 5 months window to know that baby is healthy or not. Still, whether a doctor herself is pregnant or her family members are pregnant or any other lady, whoever is pregnant, 3 to 4% chances of abnormal babies, either physically or genetically, cannot be picked up in whatever said and done scans, which we would know only after delivery. So that much risk everybody has to take. So 3 to 4% chance of anomalies are there in spite of anything. So that is the thing. Now, coming to the point that how we can prevent it. So first thing, I told you the genetic problems. Generally, this happens in that particular pregnancy and it doesn't recur in successive pregnancies, though it can happen, but most commonly no. So do not panic if you have had one miscarriage. Do not panic. What you have to do, you will have to take good amount of folic acid in your next pregnancy, even before pregnancy. Take antioxidants, take vitamin D3, B12 supplements if required. Have a stress-free life, have good sleep, start exercising, keep concentrate on your diet. So these things can help you to have good egg quality of eggs and sperms, and hence good quality of baby and less chance of miscarriage. All right. So this is about the genetic problems. Now another common cause is the smoking, alcohol. Yes, they do cause effect on the pregnancy outcome. So if you have been smoking or alcohol, stop at least 2 to 3 months before you plan for pregnancy, either ways, both the partners, and stop completely, so it will help you out. Caffeine intake, you will have to reduce. Any recreational drug abuse has to be stopped when you plan for pregnancy. Otherwise, that can end up in any of these ways. Okay. And sometimes, like patient wouldn't have gone to doctor anytime pre-pregnancy, then in during pregnancy they get to know that they are diabetic, there's high sugar values, or they're having high BP, or they're having thyroid issues. Such patients can also present with miscarriage. So fortunately nowadays everyone knows that before they plan a pregnancy, once they should have a pre-pregnancy visit to the doctor to look for all these medical disorders which can be treated and detected and treated before pregnancy itself, so that the harmful effects of these diseases are lessened during pregnancy. So in pre-pregnancy counseling, we do sugar tests, we look for rubella immunization status, we look for thalassemia screening, and also for the general checkup of a woman. So pre-pregnancy checkup is also very important. Whether it is your first pregnancy or whether it is your second pregnancy, before you plan your pregnancy, do try to visit a gynaec. That is important. So, any medical disorders, if it is there, like uncontrolled diabetes, thyroid disorders, so before you plan your second pregnancy, after a miscarriage, do treat it completely, get resolved, and then start for your next pregnancy. Other than that, the most another important cause is unknowingly if you have taken any medications during when you're planning for pregnancy or when you're pregnant, that can also cause these problems. So whenever you're pregnant, do consult doctor, ask the safety of those tablets or medications during that pregnancy, and then go ahead of taking it. Okay. And there's something called as thromboembolic disorders. In scientific language, we call it as APLA syndrome, wherein the patient is absolutely normal in her non-pregnant status, but when she gets pregnant, the small clots will form in her body, which will block the blood vessels flowing to the baby and hence stopping baby's heartbeat. And this process can happen any point of time, in the first 3 months or later on, anytime it can happen. So in such patients, we wouldn't know at first pregnancy if they have these problems or not. So after the first or second abortions, when we evaluate for these tests, then we get to know that they have these syndromes or immunological problems or the thromboembolic disorders. In that case, these patients will be given ecosprin, that is blood thinner tablets, or blood thinner injections or heparins, which needs to be taken religiously as per doctor's advice, which might have to continue for entire 7 to 8 months of pregnancy to save the baby from this accident. All right. Yes. Now, another important thing is infections. And sometimes, if there are any pelvic infection, they might have damaged the tubes, or if there are any pelvic surgeries, they might have damaged the tubes. So, in that cases, there are more chances of ectopic pregnancy. Ectopic pregnancy or tubal pregnancy, molar pregnancy can repeat in next pregnancy too. So be careful whenever you conceive. Go to doctor as early as possible and do a scan little early, maybe around 6 7 weeks, so that you would know it better. All said and done, not to scare you all, but I just wanted to put up this topic to make patients aware of this and make them understand. Now, once after a one miscarriage, if we have to look for all the causes why this has happened, there are so many tests, and we cannot keep on doing all the tests after a single miscarriage. Okay, so we look for grossly if there is any thyroid, BP, diabetes, any major issues, we look for it. We try to correct that, and then if this miscarriages happen repeatedly, that is called as recurrent pregnancy losses or repeated miscarriages, then you might have to go for entire panel of tests. You might have to get yourself a karyotyping done to see if there are any basic genetic abnormality in the couple itself. And take home message of today's session will be, if you have a bleeding in pregnancy, go to doctor, get a sonography done, and don't panic. 50% of the time the babies go well, everything will be fine. You might have to take additional rest, additional tablets and injections. Only other part you might have to, there might be something others like miscarriage can happen. So do not panic, be aware and take all the medications as and when required. Any questions, please put up in the comment box. Thank you.